Namaste बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University. In today's lecture of viral infections, we are going to discuss about measles. In the last lecture, we have discussed about mumps, and today we are going to discuss about measles. What is measles? Measles isn't just a little rash. Measles can be dangerous, especially for babies and young children. Measles is a highly contagious disease that is caused by a non-segmented, single-stranded, negative sense RNA virus of the genus Morbillivirus of the family Paramyxoviridae. So it belongs to the genus, it is an RNA virus that belongs to the genus Morbillivirus and the family Paramyxoviridae. It is one of the most highly contagious, directly transmitted pathogen. The transmission occurs by droplet spread and direct contact. So the transmission occurs by droplet spread and the direct contact. The incubation period, it is of 10 days to the onset of fever and 14 days to the onset of rash. Now this is the picture of measles, the rashes and especially the typical complex spots. The infection of measles is initiated when measles virus deposited in the epithelial cells in the respiratory tract, oropharynx or the conjunctiva. The prodrome consists of fever, cough, coryza, and conjunctivitis. It is followed by the appearance of generalized maculopapular rash. So the prodromal symptom consists of fever, cough, coryza, and conjunctivitis, and it is followed by the appearance of the generalized maculopapular rashes. The clinical feature consists of fever and malaise beginning 10 days after exposure. We have fever and malaise that is beginning 10 days after exposure. Fever is followed by cough, coryza, and conjunctivitis. The signs and symptoms increase in severity over 4 days. The typical feature of measles is the complex spots. The complex spots develops on the buccal mucosa 2 days before the rash. It consists of bluish white dots of around 1 millimeter in diameter and it is surrounded by erythema. At this stage, when the clinical manifestations are severe, headache, abdominal pain, vomiting, diarrhea, and myalgia is present, and the patient is irritable, miserable, and photophobic. The characteristic rashes of measles begins 2 weeks after infection. The rash of measles begins as erythematous macules behind the ears and on the neck and hairline. The rashes progress to involve the face, trunk, and arms with the involvement of legs, feet by the end of the second day. They can become confluent and begins to fade slowly in the same order of progression as it has appeared, beginning on the 3rd and or the 4th day after onset. The resolution of the rash is followed by desquamation. The rash develops as a result of interaction of immune T cells with virus-infected cells in the small blood vessels. The patients with impaired cellular immunity may not develop a rash and have a higher case fatality rate than those with intact immunity. Now the diagnosis and management. The characteristic rash and pathognomic complex spots are present. Serological testing, measles-specific IgM is usually detectable with 1 to 3 days of rash onset. The viral cultures and reverse transcription PCR analysis of this clinical specimen. So diagnosis is made by the characteristic rash and the pathognomic complex spots. Serological testing is done by measles-specific IgM and it is usually detected within 1 to 3 days of the rash onset. The viral culture and reverse transcription PCR analysis of the clinical specimen is useful. The management consists of the supportive care. No specific antiviral therapy of measles is present. Antibiotic therapy can be given, and vitamin A for all the children with measles is usually prescribed. Now prevention. How can you prevent measles? Live attenuated vaccine containing measles, mumps and rubella antigen, that is MMR antigen, and the administration of immunoglobulin within 6 days of exposure is usually prescribed. What are the complications of measles? The complication of measles includes giant cell pneumonitis, secondary bacterial infection of the respiratory tract, that is otitis media, bronchopneumonia. There are various CNS disorders and post-measles encephalitis that occurs within 2 weeks of the rash onset in 1 in 1,000 cases. It is characterized by fever, seizures, and variety of neurological abnormalities. Other complications include subacute sclerosing panencephalitis, that is SSPE. It is a progressive disease that is characterized by seizures and deterioration of the cognitive and motor function. Death occurs due to the bacterial superinfection, due to pneumonia and diarrheal diseases. So this was all about measles. In the next lecture, we are going to start with rubella. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We are going to meet in the next lecture tomorrow. This was all for today.